Hey, this is Dr. Alvin Philipose over at Venture's Clinic. So today I thought about just doing a little presentation for my parents that have kids with Osgood-schlatter disease. So what is Osgood-schlatter disease? It's a condition which usually occurs in teenagers, especially athletics, like soccer, track, places where teenagers tend to run quite often. It causes pain and swelling right below the knee joint. And it's an imbalance of the muscles, especially the quadricep and the quadricep tendon, as it kind of goes over the knee. And it's an overuse injury with abnormal physical stress that's put on the legs. And like I said, it's more frequent in athletes or any type of running. It's usually made worse with walking, running, any type of bending of the knee, standing long periods. Some kids outgrow it, but a lot of kids, it can actually get worse and have long-term effects and really inhibit a lot of their activity levels. It's a disease where you have cartilage when you're born that hardens into bone, and as they get into teenagers, some of the areas that have not converted to bone is what they call growth plates. You have that in your elbows, you have it in your knees, you have it in your ankles. And the growth plates of the area, what we're talking about, is what they call the tibia, which is the big shin bone that supports your legs. And as the patellar tendon, which comes out of the quadricep muscle, rubs, it tends to pull the bone from the growth plate. And since bones do not grow in the middle, but at the ends near the joint, it's an area called the growth plate. And as this area, as the child grows and the patient is running, the bone tends to kind of the tendon tends to draw the bone completely out. I think it's kind of easier to explain if you see the next picture. As the tendon is pulling, it also creates a lot of inflammation and soreness, and you kind of see why on this next picture. So up above, you'll see the femur, then the patella, and then right below it, you'll see the tibia, and you'll see in the arrow where the tendon is actually pulling the growth plate and pulling that bone out of place, and you can kind of see why it is painful. Here's a different anatomy picture showing the patellar tendon and where the lesion usually occurs, and that area is usually called the tibial tubercle. So how do I treat it? That's the bigger question. Well, normally sports activities such as running, jumping, any type of bending of the knee, I kind of limit that until the tenderness and swelling subsides. There are braces you can wear to alleviate some of the pressure and the pain, but I do really recommend that they stop the activity that they're doing because it will make it worse. I use prolotherapy, dry needling, electrical stimulation, some chiropractic, and I usually see the results in as little as 2 to 3 weeks. I also recommend any type of stretching exercise, some strengthening, especially on the quadricep and hamstring muscles. So, are steroids ever needed for Osgood-schlatter disease? Pretty common question I get from some of my parents. In almost every case, I don't recommend it because the steroids and surgery will, in fact, make it worse. The fact that the cartilage is still converting to bone, any disruption of that process may make the problem worse. What is prolotherapy? Prolotherapy is a non-surgical method of treating an injury, causing the body to recognize that injury and repairing it by stimulating the growth of new cells. It is natural, 100%. It's also known as regenerative injection therapy. And injecting that natural solution into any type of ligament, tendon, or the site of injury, your body will kind of create this connective tissue and reform that area. Patients will usually see a reduction, like I said, in less than 2 weeks and may return to normal function around 2 to 4 months. If you need any more questions or answers, you can call me at 848-7246 to see if prolotherapy or any of the other treatments may be right for your child's condition. You can also visit us on the web at venturesclinic.com. I've also got a lot of YouTube videos about prolotherapy and some of the other treatments that we do.